With the viral invasion of COVID-19, you may be wondering when and if you should get your flu shot this season. Well, experts are saying it's crucial to get vaccinated for this year's flu season since it coincides with the ongoing coronavirus pandemic. But it's hard to know for sure how COVID-19 will mix with this year's flu season. Will mask wearing and social distancing contain flu transmission? Or will both viruses simultaneously wreak havoc on the nation? A twindemic, as some are calling it. The CDC is recommending everyone 6 months and older get a flu vaccine this fall, adding that it is crucial to minimize the impact of the flu season as much as possible. Understanding some basic yet essential facts about the flu can save your life, or at the very least save you from the aches and fever that go along with being down for the count with the flu. Neuzil and Shannon Messner, both board-certified nurse practitioners at Allergy Sinus and Asthma Family Health Center, talk about some important things you should know to stay healthy this flu season.
When we look at the flu season is generally looked at from the first of the year, January 1st through March 30th. Now, it doesn't mean you can't get the flu other times of the year. You can get a flu in November, December, just generally not as common. What we try to do is vaccinate everybody early to help prevent them from getting a flu.
With the flu, you're going to have more of the fevers, the body aches, the chills, along with the other symptoms of the cold. Whereas the coronavirus, it comes on quicker and it's more severe. So you'll have the difficulty breathing, the cough, the shortness of breath, higher fevers, that type of thing. So it's more of a progression of symptoms. So from mild to moderate to severe is kind of how we look at it.
Very commonly I have patients come in and they say, well, my throat was scratchy the other day and it was a little bit hard to swallow. It's getting better, but now my head's all stuffy and my nose is plugged up and it's running, but everything is clear. Okay, so that's generally more of cold-like symptoms. Flu, you're generally looking at something a little bit different. You can actually have the nausea with or without vomiting. You can have gastric cramping. You can have diarrhea. These are more of your flu-like symptoms.
We recommend flu shots for all of our patients, especially because a majority of our patients are over 65 or they have allergies and asthma. So they are at an increased risk of having complications from the flu.
Actually, everyone that does not have a contraindication to get the flu shot should get it. The fact that you were lucky and never got sick doesn't mean that tomorrow's not another day. It's your immune system, it's your exposures, and it's blessed that you didn't get the flu in the past, but you can still get the flu, and the flu can just be as deadly, even though you've never had the problem before.
To get in touch with the specialist at the Allergy, Sinus, and Asthma Family Health Center, just click the Fending Off Flu story link icon on our homepage at yourhometownhealth.com.